Dr. Romani is an emergency room doctor in Straight Richmond Hospital in Cape Breton, hours from a major centre. Now thanks to PACS, Picture, Archiving and Communications System, Dr. Romani can get specialty consultation minutes after a diagnostic exam is performed by working with a radiologist who is hundreds of miles away.
So even in the after hours, we know that who is on call, the radiologist, and then we can call them and they can access immediately the images and they can give me the reply. Dr. Silva, please.
That's because today, all radiological exams performed in Nova Scotia, including X-rays, MRIs, and CT scans, are digital. Now, doctors and specialists can share exams and consult from anywhere over a private, secure network.
PACS has revolutionized diagnostic imaging. The ability for physicians to visualize and interpret images on their patients is something that we can do much more efficiently now than we could in the past when we were using film.
Radiologists used to have to wait for film to be processed and delivered by mail or courier before they could consult on a patient.
It has streamlined the workflow by having the images developed and available to me immediately after the patient has been imaged by the technologist.
Once fully implemented across the country, it's estimated that PACS will generate anywhere from $850 million to $1 billion in cost efficiencies, thanks to increased productivity, reduced patient transfers, fewer duplicate exams, and the elimination of film costs.
The individual radiologist, I believe, has always been efficient in interpreting examinations and consulting with physicians. But it's the time between those interpretation periods, the time we needed to pick up old films, to find information that wasn't readily available, that has been completely wiped out from our day.
PACS has increased capacity by 25%. The equivalent of adding 500 radiologists across the country, according to a new report by Canada Health Infoway.
The benefits for the patient are enormous and in some cases could be life-saving. They will get faster treatment to the treatment that they're used to today because these images can be transported to clinicians hundreds and thousands of miles away to be read. And for our patients who are living in remote and rural areas, this is really important.
The direct accessibility to images and reports by medical staff creates new possibilities for collaboration.
There could potentially would be a pericardial cyst. That's one.
It's good to have the ability to sit at a console, talk to another physician. We're both looking at the exact same image at the exact same time. We can say, slice number 37, look at the left kidney. What do you think about that? He looks at the same thing, so there's no guesswork. You're both looking at the same thing. It makes a huge difference.
I can get a more feedback from the radiologist regarding any problems with the patient. Yeah, it gives a lot of confidence to me.
I think the real benefit is the timeliness of quality care that's provided by the specialist in imaging to the referring physician.
The benefits of the tools are really speeding access to care, cutting wait times for diagnostics in half, and quite frankly, improving the quality of care.
I think above all helps us give much better service to the healthcare industry in general and to the health of the people of the country.